Hello, everyone. We're just going to get a moment for people to connect, but thank you for joining us today, and we'll start in just a minute. Hello, everyone, and welcome to our ISPCAN Monthly Journal Club. My name is Jane Estes, and I'm the Knowledge and Content Development Manager for ISPCAN. ISPCAN's monthly international journal clubs are always free of charge and cover diverse research topics which are presented by subject matter experts from around the globe. These 90-minute webinars are designed to help you, our members and partners in the ISPCAN community, gain access to knowledge and expertise to inform care, improve practice, and drive policy change. All this is critical to help improve the outcomes for children globally. Today's objective is to recognize author excellence, innovation, and advancements in the field of child abuse and neglect by highlighting our 2022 ISPCAN award-winning papers. Tips for making the most of today's session. Please engage with us. This session is meant to be an active, interactive learning platform. Please participate by sharing your comments in the chat and your questions in the Q&A box throughout the webinar. We will use your questions to begin the Q&A session immediately at the conclusion of the presentation. Because we are presenting on 3 different papers, if you'd like to begin to add your Q&As after each paper, that would be great. And also, please take a moment to introduce yourself to other attendees, our moderators, and our featured presenters in the chat box. Let us know where you're joining from, your organization, and your discipline. And to enhance your experience, you may enable closed captioning on your Zoom control bar by choosing captions. And as always, for joining us today, a recording of this session, the panel discussion, presentation slides, and links to the featured resources will be sent to you directly after the webinar. And now it's our sincere honor to present to you the ISPCAN Elsevier award-winning papers presented by the key authors involved in this work. The order of the papers will be the following. Our first paper, The Impact of the COVID-19 Pandemic on Child Protective Services, Caseworkers, and Administrators. The second paper that will be presented today is 1 year into COVID-19. What have we learned about child maltreatment reports and child protective service responses? And we'll conclude our presentations today with the 2022 Paper of the Year, Maternal Childhood Abuse and Neglect Predicts Offspring Development in Early Childhood, the Roles of Reflective Functioning and Child Sex. And now I'd like you to meet our moderator for the session, who will introduce our lead authors for each award-winning paper. Dr. Nicole Racine, clinical psychologist, assistant professor, and director of the Early Lab at the University of Ottawa. Dr. Racine holds a research chair in youth and mental health at the Children's Hospital of Eastern Ontario, where she collaborates with clinicians and community agencies to conduct research on child trauma. Her research examines the impact of early adversity in early childhood and identifies prevention and intervention approaches that promote resilience for children exposed to maltreatment. Dr. Racine is a special issues editor at Child Abuse and Neglect. In addition to having published over 100 papers in high-impact journals in the fields of mental health and trauma, her work has been included in key policy documents on mental health by the Royal Society of Canada and has informed bills put forward to the House of Commons. Her work has also been cited in key position papers on child mental health, including reports from the U.S. Surgeon General's Advisory, UNESCO, UNICEF, and World Bank. Nicole is deeply committed to sharing knowledge that will improve policies and program implementation for children exposed to adversity. And now I'd like to turn the session over to Dr. Nicole Racine.
Great. Thank you so much, Jane. I'm truly delighted to be moderating the session today. I'm just going to get my slides up here. Great. So on behalf of ISPCAN and Child Abuse and Neglect, the International Journal, I want to welcome everyone to the webinar today. This is one of our most exciting webinars of the year because we are celebrating the excellence of authors who have contributed to our journal. And ultimately, we really want to recognize author excellence, innovation and advancement to the field of child abuse and neglect. And what we will learn from the authors today and what you will see is that these authors are really pushing forward the field of child abuse and neglect, and we're really delighted to celebrate them. So thank you for joining us. I'm really looking forward to hearing from our authors of the award-winning papers. I want to take a little moment to talk about the selection process for these award-winning papers. So among all articles that are submitted to our journal, we used a number of criteria to be able to narrow this down to a short list of 6 papers. And each year, child abuse and neglect receives more than 1,500 article submissions. So that gives you a sense that these top 3 articles are really the creme de la creme. They are the top articles among 1,500 that are submitted. And of articles that are submitted, less than 20% end up being considered for publication. So you can see this is really quite a prestigious recognition. So once the top 6 articles were identified, they were put forward to our editorial board and evaluated for their novelty, potential impact in the field, extent to which they advanced the field, and their high academic quality. And 3 papers ultimately were selected, 2 for their honorable mention and 1 winner. So I want to congratulate our authors, Julia Garon-Bissonnette, Ilan Katz, Sydney Priolo-Filho, and Veronica Renov. These papers are at the cutting edge of those published in our high impact journal. Congratulations, and thank you for your contributions. Our winning paper, led by Julia Garon-Bissonnette, highlights practice implications for parenting interventions on positively and proactively enhancing reflective functioning to support maternal emotional availability and curiosity in child development. And I'm really looking forward to hearing about Julia's paper and about the intervention that she'll describe. Our first runner-up paper, led by Ilan Katz, explored an international platform to examine child maltreatment reports during the COVID-19 pandemic in 12 regions around the world. This is also a very important paper because it highlights the negative impact of COVID on child protective services and also on children and their families, which we know all the clinicians who are here who were working on the ground during COVID will certainly be able to recognize the importance of this. And we'll also hear from Veronica Renov, who documented how the COVID-19 pandemic changed how CPS workers conduct investigations. And using both qualitative and quantitative methodology, the authors showed how creative solutions were adopted to keep families safe. So again, we have a number of international members in our audience today, and I think this will be relevant to everyone. So really looking forward to hearing about this paper. Now is stop sharing my screen. And I think we will switch things over to our first presenter, who will be Veronica.
Hi, thanks everybody for joining.
Great, so I'm excited to introduce you, Veronica. Veronica was born and raised in Los Angeles and attended the University of Southern California and went on to complete medical school training at the Medical College of Wisconsin before moving back to LA to do her residency training at the Children's Hospital. She subsequently moved to Pittsburgh to do her fellowship training in pediatric emergency medicine at the UPMC Children's Hospital of Pittsburgh, and her primary research topic is in adolescent confidentiality. So along the way, life happens, as we know, and she's found her partner and also has a 2-year-old son and another on the way. And so we're really delighted that you're joining us, Veronica, and we can't wait to hear about your paper, and congratulations.
Thank you so much. All right. So I am going to be talking about the paper that I wrote with a great group of authors entitled The Impact of the COVID-19 Pandemic on Child Protective Services and Caseworkers and Administrators. So this paper was really spurred on by concern that we all had that the stress that was caused by the pandemic was translating into potentially increased child abuse and neglect, as well as IPV, intimate partner violence. And intimate partner violence is a topic that's not addressed in this paper specifically, but was studied by the same group. And so there are additional papers on that. We noticed that there was a decrease in visits to the emergency department for child abuse and neglect, but there was an increase in hospitalizations and a concern that injuries that were found were actually more significant. Additionally, I think we all understand that there was an increase in healthcare worker stress and burnout. And internationally, there was significant attention paid to first responders of all types, but Child Protective Services was rarely included under that heading. So this was a qualitative research study primarily where we conducted one-on-one interviews with caseworkers and administrators from Child Protective Services agencies nationally in the United States. We had 4 trained team members who conducted these studies, these interviews, and then transcribed and coded them into the main themes that arrived. We were a large interdisciplinary study team that comprised many academic institutions, nonprofit agency Futures Without Violence, the American Academy of Pediatrics, and the CDC's Division of Violence Prevention. So we had 37 participants, 21 of which were caseworkers, 16 of which were administrators from 12 United States. These are, and the majority of the people that we spoke with were non-Hispanic white females, which is a representative demographic of Child Protective Services workers, though not, of course, of the United States population as a whole. And geographically, we were a little bit limited in some of the states that we were able to conduct interviews with, partially due to who responded to our multiple requests and partially due to some state laws. So there were 5 main themes that emerged from the many transcribed interviews, and I will go through these now. Firstly, we talked extensively about the impact of the COVID-19 pandemic on conducting investigations. And the main takeaway was that Child Protective Services workers did continue to adhere to investigation and removal guidelines, despite having concern about their own physical health and the health of their clients. And I've included quotes from Child Protective Services workers, caseworkers, as well as administrators in purple. So there were many modifications that were used, including outdoor interviews, virtual visits, meeting in public spaces, but people definitely noted that it was harder to meet even in public outdoors during the pandemic. And then, of course, there were privacy concerns regarding virtual interviews. There were a lot of caseworkers who were concerned that the children that they were seeing weren't necessarily alone and weren't necessarily always the most uninhibited. So they were always very aware of trying to make sure that privacy was maintained. The next theme was the impact of the pandemic on provision of ongoing child protective services. So ongoing services, those which were going before the pandemic, so things that were not new investigations, did largely switch to virtual. There were certainly times that they went into homes, but they attempted to only go into homes of families if it were truly an emergency for outside of those initial new investigations. There were concerns that came up regarding foster family availability. There were fewer foster families that were able and willing to participate in the program. There were more problems basically getting children into foster homes and having to do with COVID testing and, kids turning positive and families not being able to accept them. There were challenges surrounding visitation with parents as well, which the AAP actually released a statement on, saying that families should be allowed to visit with their children when at all possible. There were also many caseworkers who noted improved engagement with families due to these virtual alternatives, which I think is an overarching theme of our paper. There were a lot of challenges, but there were certainly plenty of silver linings. I'll get to that in a minute. So opportunities and challenges for Child Protective Services staff who are working remotely. So this is talking a little bit specifically about the Child Protective Services caseworkers and administrators who are working remotely. Many of them noted increased productivity from being able to work from home. Some of them felt like there was a better work-life balance. There were, of course, also people who felt like it was almost more stressful to be working from home because they also had children and other family members at home who were doing virtual learning, and they had a lot of things to balance. However, there were, of course, technologic challenges as well that caseworkers felt like they were mostly able to overcome with support from their organizations. So giving them the cell phones and laptops to be able to work virtually. And then finally, court cases, which are an important part of Child Protective Services, switched to virtual, which many, if not all, caseworkers felt really improved their efficiency. Rather than going into court in the morning and having cases be canceled or delayed and not being able to get any other meaningful work done while they're waiting, they were able to know, my case is going at 9:30. I have another case at 10:30. I can do work in between. And then Child Protective Services staff experienced burnout and challenges obtaining PPE. So this was a huge topic that we talked about. There was significant stress to the caseworkers, especially because they were going into homes to obtain adequate PPE. They felt like they were not recognized or supported as frontline workers, despite having to go out onto the literal front lines of the pandemic. So going into homes of families who might have COVID, which was obviously very scary for them at that time. And there was really no change in what they were doing as an agency in terms of going into homes for new investigations. And then there were significant concerns regarding burnout, regarding job retention. The number of Child Protective Services caseworkers nationally decreased. However, again, a silver lining, there were definitely additional supports that were implemented to combat burnout, which many people were really grateful for and were looking forward to continuing after the pandemic. And then finally, there were new ways that Child Protective Services agencies and staff were able to support children and their families during the pandemic. So some agencies, and every agency in every state is run a little bit differently here in the US, but some agencies were able to proactively reach out to families. There were also caseworkers that were very eager to connect families to supports within the community, some that were in place before the pandemic and some that were newly put in place during the pandemic. They did note that there was an increase in family requests for basic resources, technologic supports, help paying rent or their electric bill or cell phone bill. And then, as I alluded to, there were some agencies that did create COVID-specific support systems, like a care portal. So I think this paper was really great at highlighting the stressors of the pandemic, but also the opportunities that the pandemic provided to Child Protective Services here in the US. There are certainly resources and support that are needed for families in the Child Protective Services system. And private virtual services, I think, was the biggest thing that came out of this as a real opportunity of somewhere to continue. I think it's very important that we talk about burnout among all healthcare workers, but certainly among Child Protective Services workers who, really benefited from having flexible schedules, increased mental health supports, virtual trainings. And then it's certainly something to think about when we're talking about disaster planning as a whole. So including the children and families who are in the Child Protective Services system into disaster planning efforts in the future. And then clearly identifying Child Protective Services workers as frontline workers to ensure that they have ready access to PPE and other important resources that other frontline workers were able to get. That's all I have for now. Thank you so much. I have the entire author team below and would be happy to take any questions later.
Thank you so much, Veronica, for that very impactful presentation. Your paper just covered so many really amazing parts of the COVID-19 pandemic that I think warrants further research. So I love that you included what's next. So anyway, thank you so much. Just a reminder for our audience to please put your questions in the Q&A box now, as everything is fresh of mind, so we can open it up to questions at the end of all the presentations. And at this point, I would like to pull up the slides for our next presentation. I will. Elan was not able to join us, but Sydney is here to present on this paper. So I will turn this over for your introduction. Nicole, thank you.
Great. Thanks, Jane. So Sydney is a professor at the Department of Forensic Psychology at the Universidade Teodo do Parana in Brazil. Currently, he leads a research initiative focused on adapting the NICHD protocol to Mozambican Portuguese and Mozambican Sign Language. Additionally, his research group has been involved in research regarding sexual abuse disclosure at different ages and contexts. And he has engaged in research prevention and intervention efforts related to child abuse and intimate partner violence throughout his career. He is in Brazil today joining us and has informed us that it's quite a warm day there. And so we really look forward, Sydney, to your presentation, and thank you for joining us.
Thank you, Nicole. Thank you, Jen. I'm going to present this work that is about a whole group of people. So those are all of our authors that contributed to this paper. So this mention is to all of our colleagues that help throughout the process of writing, of designing, of analyzing this data. So some of them I saw they are here on this webinar as well. And one of the things that I would like to highlight here is that this is one of the papers that is a series of papers from this group. If you look at our research, our academia, or ResearchGate, or Schooler, this whole group has a lot of different papers, and we're going to present a little bit how our path towards this specific paper took form. So this group is led by Professor Karmit Katz from the Tel Aviv University, and Karmit has been doing wonders with this group, leading us towards how to increase our knowledge during the pandemic about child protection, child protective service. And it's really interesting because what we saw at first is that the risk factors for child abuse and neglect were increased by COVID. But we didn't have a lot of information about how those different responses and how countries would get back to COVID to protect children. So we had a lot of information in the beginning of the pandemic about parental stress, financial pressure, lack of access to schools. Remember, the schools were closed by the beginning of the pandemic. And there was a lot of concern about illness or death due to COVID in adults, but with children as well. So one of our first ideas here is that we try to investigate how the first wave of COVID impacted protection service. And what we saw is that there was a decrease in most countries. That's a paper that was published in 2021. And we saw that almost every single region that we surveyed and that we found data showed a decrease in child abuse notifications and reports. This was true in most cases because children were not attending schools and teachers were the main responsibles for providing this sort of notification. But we saw a lot of different policies responses, even at the very beginning of the pandemic. While we saw some countries showing innovative practice using internet access, providing internet access to families, other countries had a lack of access for families and had a lack of access to data. So this takes us to one of our first papers that we tried to create a global framework of what we should study during the pandemic. This is on a paper that has Professor Kamit Kaz as first author. So we had this big discussion in the group, what is important to everyone? So what actually matters to all of us during the pandemic? And this paper about the policies led us to start collecting data and to start thinking about problem solving during the pandemic. And what we saw with this study in particular, we were trying to examine the trends in reports to CPS after 1 year. So since we already had the data of the year before with the 2021 paper, we tried to see if those countries had any difference after 1 year. And also, if there were any changes in their policies after that period. Also, how they would adapt, because some countries, the children were back at school, some countries, children were still out of school, the schools were closed. So we had a lot of those different aims with this paper. We surveyed the Australia, Brazil, California, Colombia, England, Germany, Israel, Japan, Ontario, Pennsylvania, Quebec, and South Africa. So we had a lot of different regions that we're serving, and we're going to present some of the data here in this presentation. To do that, we gather information regarding demographics, how was the economic situation at the time, and how the CPS responses to COVID. And this could be either we have papers about how the CPS responded, we had national policies, and we have any official documents. So we provided a descriptive analysis to try to check, to have an overview of the prevalence of COVID and how each country or region responded to the pandemic. After that, we saw that there's a lot of challenges and a lot of limitations when we do that kind of work. The first, that our data is not actually compatible across regions many times. That is due to how each country or region reports child abuse data. And because many times we did not have unofficial data. So there was a lot of time lags, especially in the countries with the worst COVID responses regarding child abuse data and how was that at that time point. Also, some responses were very localized. So you would have one city or one small region showing some sort of innovative practice, but that was not true to the whole country or whole region. And there was a lot of difference in how those countries or regions implemented those policies. So you will have sometimes a national policy on child abuse, on child protection, but there was difference in how those regions implemented those changes. This is one of the graphs that we have in the paper, and it is one of my favorites because it shows the countries or regions in red. They have the highest numbers of COVID-19 cases per million, the highest economic impact, and they have the longest time with school closures. And what we see is that every single of those in red, they have the worst responses, they show a unique pattern. Some of them had an increase in reports, some of them have a decrease in reports. It's not really up to us to really identify. Those countries that had a median impact, so they didn't have a lot of COVID cases, they show a similar pattern, are those in yellow. And those countries that have a better response to COVID, they didn't saw a lot of difference after 1 year in the pandemic. So this is very interesting for us to check, because it seems to us that the better the COVID response, the lower the impact on child abuse reports we saw. So this is very interesting for us, because we saw this 1 year trends that you see Australia and in Germany, and you see a lot of those places that have lower impact of COVID showing no change after 1 year. And you see some countries that you could not actually access that. So it can be higher, it can be lower. Adding to that, one of the things that really grab our attention is that the first decline in child maltreatment reports was reversed to the baseline after 1 year in the pandemic. But what really grabbed our attention is that some areas continued with the low reporting rates, and some declined even further. So what happens that the prevalence was probably high because, including hospital admissions, mental health referrals, etc., we saw a lot of those increasing during the pandemic, but the actual Child Protective Service was not accessing those data and were not protecting those children. One key aspect of our discussion is that there's a mix of economic and social impacts that posed risks for parental stress and children's vulnerability, but that was really true for low-income countries. So some countries that were already facing a lot of challenges prior to the pandemic increased those challenges for the professionals, families, and children. And what is interesting is that social vulnerabilities and child maltreatment were not related to CPS reports. So this is something that grabbed our attention, because many times you think that social vulnerabilities will be a key factor for that. But what we think really happened is that those children that were vulnerable were not actually accessing the services. So they did not receive care after 1 year in the pandemic. About the implications of our study, it seems that those reports are not a good proxy for prevalence or risk. And we're still collecting data about that. And it seems that this is a key component for us to evaluate risk. But after the pandemic, this got all mixed up. So this is something that we need to discuss as researchers, practitioners, and as professionals who are thinking about child protection. We need to understand that CPS is part of a broader system, but especially we need to focus our attention in schools, because when every single country closed their schools, CPS reports decreased, and after schools are reopened, we see an increase in a lot of areas. We still don't know the long-term impacts of the COVID-19 pandemic in children. And what we saw in many cases is that professionals in CPS, working at CPSs, are very innovative and effective, but there was a lot of trouble having access to online and virtual contact with the families. Finally, this article is one of a number of articles produced by this international collaboration. And we just published it now in 2024, some papers focusing on particular populations, practitioner well-being, their practice. And we have a further wave of data that is being analyzed by Elon at this very moment. And we want to highlight this importance of collaborating and understanding how CPS and child maltreatment patterns are similar and different in the world at the same time. So this for us, I think is the main course of action here. When we have a lot of different areas with their unique responses, with their unique system, we saw a lot of similar patterns along the way. At the same time, we saw when things went bad, they went bad for a variety of reasons, and that impacted child protection in many ways. So I think that's a summary of our paper. Professor Ilan has led this paper. I'm really proud to be a part of this team as well. And just want to highlight again the role of Professor Kermit Katz in our group, that she's key to organizing and having everyone together working towards this goal of child protection. Thank you very much, Jane and Nicole.
Thank you so much, Sydney, and thank you for stepping in. I apologize if I wasn't moving your slides at the right moment, but again, you did a wonderful job presenting the paper. Just a reminder to our audience to please make sure that you type your questions in the Q&A for Sydney and for the other authors on this paper, so we can use them at the beginning of the open format at the end of the session. And at this point, I'd like to turn it over to Nicole and Julia as we present the award-winning paper for 2022.
Wonderful. So I have the pleasure and privilege of introducing Julia Guérin-Bissonnette, who is the lead author of our winning paper for Paper of the Year for 2022. And I'm very delighted because this is also a topic that is near and dear to my heart in terms of intergenerational transmission, and really focused on maternal child abuse and neglect and impact for offspring. Julia is a postdoctoral researcher at Vanderbilt University. She earned her PhD in psychology at Université du Québec à Trois-Rivières. And this award-winning paper was part of her dissertation. Her broader PhD focused on developmental mechanisms involved in intergenerational repercussions of child maltreatment, with a focus on clinically responsive mechanisms to better inform interventions. So she's really focused on mentalizing and reflective functioning, which we know is so important, especially among parents who have experienced adversity. And she focuses on timely developmental periods, including pregnancy and infancy, and the interplay between caregivers, the individual child, interpersonal and psychosocial risk, and protective factors. So a wonderful accomplishment, Julia. We're so glad that you're here to share about your paper with us. And I know your proud supervisor, Dr. Nicolas Berthelot, is here also. So wonderful, and we can't wait to hear from you.
Thank you very much, Nicole, and thank you so much to ISPCAN for this opportunity as well as this recognition. I want to stop here and just acknowledge my co-authors, without whom this work wouldn't have been possible. And then I'm gonna get going with the presentation. As I think everyone probably knows here, exposure to child abuse and neglect or childhood maltreatment links to a myriad of consequences across all spheres of functioning, starting in early in development in childhood and then also persisting into adulthood. And so research has also shown long-lasting consequences of childhood maltreatment during the pre and postnatal periods, with associations with psychological symptoms, biomarkers of stress, as well as a higher risk of re-victimization during the pre and postnatal periods. In the absence of protective factors, childhood maltreatment is also associated with intergenerational impacts, and an important body of literature and now many meta-analyses has documented the risk of intergenerational cycles of trauma, and parental trauma would be the most important risk factor for child maltreatment according to a recent meta-synthesis of the literature. Even in the absence of a repetition or a continuity of trauma or maltreatment, parents' history of childhood maltreatment is likely of intergenerational impacts or repercussions, is associated with a higher risk of caregiving difficulties, and with behavioral or developmental difficulties in children. And I would say most of that body of literature comes from studies on temperament or socio-emotional development. research on the association between childhood exposure to maternal exposure to childhood maltreatment and offspring more global spheres of development is more scarce. And to my knowledge, at least when we wrote that paper, was based on 3 studies where they found kind of different findings. And so, for instance, children of mothers haven't been exposed to childhood maltreatment would be more likely to report concerns regarding their child's development, and their child would be at higher risk of suspected developmental delays as well. However, as Nicole said, with her interest aligning with mine, I think one of her previous studies has shown that maternal exposure to adverse childhood experiences was not directly associated with offspring development, but had an indirect effect through biological and psychosocial risk factors, such as pregnancy and health risk, maternal prenatal psychosocial risk factors, and hostile behaviors. And so we see kind of different results. Some suggest maybe a direct association, maybe not. One rather recent study also suggested that some determinants of child development may be different in boys and girls. And interestingly, there's one study that has suggested that toddler boys may be more vulnerable to the effects of maternal adverse childhood experiences, at least when we look at their development. Now, I think to better inform clinical practice and to kind of push research, because we know that childhood maltreatment is associated with all of these repercussions. Well, I think it's important to turn to mechanisms and protective factors that are also at play and that may influence the strength and statistical significance of these associations. In our research, in our lab, and this paper, we focus on mentalization or reflective functioning. And so briefly, reflective functioning represents one operationalization for the theory of mentalizing and is defined as the ability to perceive and interpret human behaviors in terms of intentional mental states, such as emotions, wishes, goals, or desires. And so it kind of represents the ability to keep the mind in mind, both our minds and the minds of others. Mentalizing or reflective functioning is an umbrella capacity. It integrates many processes, for instance, some cognitive abilities as well as some affective abilities. And it's a construct that is fundamentally social and relationship-based and is dependent on their caregiving context as it emerges from the attachment relationships. And so it really is a theory that is embedded in attachment theory. The development of reflective functioning would thus be compromised by childhood maltreatment. And I'm not going to go into too much detail on this for the sake of time, but we can think about children growing up in maltreating household where they might not have access to a mentalizing model, or where they cannot explore their emotional world safely, for instance. And there are many other trajectories in which that may be the case. Another reason why reflective functioning is, in my opinion, an interesting mechanism to study in caregiving research is that when developed, well, this ability to think and interpret behaviors in terms of their underlying mental states would allow to imagine the child experience, to guide behaviors accordingly, and therefore in research it has been shown to be associated with caregiving sensitivity and child secure attachment, and would also promote early emotional regulation and behavioral development. And so the objective for that current study was to investigate whether impairments in reflective functioning mediated the association between maternal childhood maltreatment and child development between 11 and 36 months postpartum, and whether this association was also moderated by child sex, given that one study that showed different effects for boys and girls. And in addition to considering a continuous score of child development as a primary outcome, we also computed a score of clustering of developmental delays. And so our measure of development, which I'm going to talk about in a few seconds, measures 5 domains of development. And we look at whether children accumulated potential delays in those domains rather than only looking at a continuous score, which may bear more significance in regards to their later development when we use self-reported, parent-reported measures in research. Our sample was 111 pregnant individuals. They all identified as women, and they participated first during pregnancy, and then they were followed up for a questionnaire based on their child's development between 11 and 36 months. We used only self-reported measures here in this study, and one I'm going to focus on here is our measure of reflective functioning. We used a reflective functioning questionnaire, which measures two impairments or deficits in reflective functions. That is hypomentalizing or uncertainty about mental states, and hypermentalizing or certainty about mental states. The first deficit, hypomentalizing, reflects an inability or an unwillingness to consider the complexity of mental states, or a rather distant way of thinking about mental states. And the second one reflects more of a tendency to be overly certain or excessively certain or detailed about mental states without providing the appropriate evidence to support the claims. And in our study here, we used the structural equation modeling approach, and used the latent variables reflecting both deficit and RF. And so our variable really shows more broader difficulties in reflective functioning. We used the ages and stages questionnaire, which measures fine motor, gross motor, problem solving, communication abilities, as well as personal and social abilities. And then we measured 3 prenatal mental health symptoms to use as covariates. In terms of our results on our main question being, can reflective functioning buffer against the intergenerational repercussions of maternal childhood maltreatment? Well, we found that deficits in reflective functioning, but not prenatal mental health, were associated with child development between 11 and 36 months. And then when we fitted that in a structural equation model, we found that maternal childhood maltreatment only had an indirect effect through child development through difficulties in reflective functioning. And so we observed no longer a direct association between both variables when we considered reflective functioning in the model. In a third step, we found that maternal childhood maltreatment, but not child sex, significantly predicted child clustering of developmental delays, so suggesting that overall, boys and girls have similar developmental outcomes in our sample. However, when we added an interaction between maternal history of childhood maltreatment and child sex, and so when we look at whether they interacted together, we found that child sex moderated the association between maternal childhood maltreatment and the accumulation of developmental delays, with boys showing increased developmental delays when their mother had been exposed to childhood maltreatment. And we conducted relative risk, and we found that boys of mothers with histories of childhood maltreatment were at an increased risk of almost 3, so 2.62, whereas girls whose mother had experienced childhood maltreatment, their risk increased only of 1.5 when they were compared to children of mothers without histories of childhood maltreatment. And so a risk that is enhanced for boys. When we looked in a second step at the predictors of this accumulation of developmental delays in both boys and girls, we found different determinants for boys and girls. And so for boys, maternal childhood maltreatment was directly associated with developmental delays, whereas for girls, it was difficulties in reflective functioning that directly predicted developmental delays. And so to sum up, I think our results confirmed our theoretical model that maternal childhood maltreatment prospectively predicts a child's general development, and that this association was mediated by mother's impairments in reflective functioning. One possible route to which maternal reflective functioning may impact offspring development, I think, is to caregiving behaviors. We may hypothesize that, for instance, when a child is facing a developmentally challenging task, caregivers may feel emotions that evoke or reactivate their past history of maltreatment, such as shame or helplessness or frustration. And so if caregivers have difficulty making sense of those emotions, or tend to keep, for instance, a distance from their internal world, well, that may lead them to withdraw, at least emotionally, from the interaction, leaving the child alone with a difficult task, and the child then may not benefit from mother support to learn, to communicate, to solve problems, interact, or to explore their environment. In a complementary and I would say exploratory approach, we also found that the association between maternal childhood maltreatment and the clustering of developmental delays was moderated by child sex. And we found that child sex was not associated with overall development, but it really interacted with maternal history of childhood maltreatment, and that the determinants of developmental delays were different in boys and girls in terms of maternal childhood maltreatment and maternal reproductive functioning. And these results are still quite preliminary, and they support a very small body of literature. And so further research is required to enrich our understanding of the intergenerational repercussions of maternal exposure to childhood maltreatment on offspring development and on the kind of different transmission processes in boys and girls. I think our study has several strengths, such as the use of a longitudinal design, but should be interpreted in light of some limitations. First, we use only self-reported measures here that may be prone to biases in reporting, as well as shared method variance. Although I'll say we have replicated since these results using an interview-based measures of reflective functioning and found really similar patterns for the protective role of reflective functioning, I think, which makes me feel better about using only self-reports here. We did not evaluate other developmental protective factors, such as living in a safe neighborhood or having other close adults that may all also contribute to develop reflective functioning despite childhood maltreatment. And our sample is quite low risk and non-diverse sample of a French-speaking pregnant woman from Quebec, Canada. I think these results support the development and the implementation of mentalization-based intervention during the prenatal period, at least for I think for every parent, but maybe more specifically for parents having experienced childhood maltreatment. And currently, most intervention and prevention programs, at least on the peripartum period, focus on teaching parenting skill or on parental psychoeducation. And I think our results suggest here that adding a dimension of what it is like to be a parent, to be curious, to be interested, not always know what the child may think or feel, but try and know, is also essential for the development of our infants and toddlers. So thank you all. Thank you to the families who participated in our studies.
Thank you so much, Julia, for that wonderful presentation. At this point, I would like to invite Nicole to give us some closing comments before we go to Q&A. Just a reminder before Nicole takes over to please make sure that you type your questions in the Q&A. I know our authors have been great about answering some, which I will ask live as well for the audience members who didn't have a chance to view those. But again, we're welcome questions ready to go in the Q&A so we can go to the open session flawlessly. Thank you.
Great, and thank you so much, Julia, for that great presentation. See lots of congratulations also in the chat. I'm going to share my screen just briefly for some closing remarks. So just another thank you and congratulations to the authors. Well done. It was so interesting to hear all of your findings and for you to have these papers come to life. So thank you so much for sharing those with us. A couple of notes just on behalf of the journal that we do have upcoming special issues, particularly with regards to children's right to participation in the context of child abuse and neglect, as well as global advancements in adapting, evaluating, and implementing nurse-family partnerships. So if that is relevant to anyone or anyone has any papers that might be related to these special issues, please do send them along. And then I just wanted to give a final plug around the new journal, Child Protection in Practice, which is an open access sister journal to Child Abuse and Neglect. that typically will have open access fees, but these fees are waived until December of 2024. And so we welcome submissions to this journal also. Great. So now I think I'll pass it back over for moderation of questions for our authors.
Yes, thank you very much. So we invite all of our authors to turn their cameras and mics on. And then, Veronica, do you want to introduce Tammy, and Julia, do you want to introduce Nicholas?
Sure. Tammy Hurley is here with me. She is a member of the American Academy of Pediatrics and is the director of child violence. I think I'm getting that wrong. But she is here and was a member of the team who worked on the paper with me.
Okay, thank you.
And then Nikolai is here today. He was my PhD advisor, and he's a clinical psychologist and professor in Quebec, Canada. And then also developer of the STEP program, which is a prenatal intervention developed for pregnant women having been exposed to childhood maltreatment. That's really informed by part of what I presented today, and that's based on the mentalizing theory. And so happy to answer questions about that too, I think.
Thank you to Tammy and Nicholas for joining us as well. We appreciate you being here for the Q&A and for participating in, again, the great work that was presented here. So I'm going to go just to the Q&A questions that were asked, and then I had some that were sent directly to me that I will ask as well. The first one is, I believe, for Julia. Yes, it says, do you have any thoughts on why you observe these differences in effects on boys versus girls?
That is a very good question. And I think those results are still preliminary, so we don't know a lot about that. Although some research on other areas might be helpful to try and make sense of these results. And so, for instance, there has been research on different association between maternal prenatal psychological symptoms or mental health and the association with child development later on. And they also found usually different association for boys and girls. And a couple of studies have found that, for instance, maternal depressive symptoms would be associated with development in boys earlier on. I think it was at age 2. And in girls, that association would show up later. And I think that was by preschool age. So maybe what we're seeing here is an effect of age and of different vulnerabilities at different age. Also, I think hypotheses on and research on fetal programmation shows that fetal boys might be more vulnerable to risk factors during the prenatal period, such as like drugs or even pollution or those types of risk factors. And so this is very different from what we measured here, but that might show similar mechanisms at the biological level. But I'm really not familiar with those biological mechanisms, so I don't want to say something that I'm not meant to say.
And Nicholas, anything you'd like to add or no?
I think Julia answered beautifully, but maybe just adding that since Julia's initial finding, we replicated these findings in 2 different samples. So there's really something, seems that boys are more vulnerable to the effects of maternal trauma than girls, and we have a lot to learn about that. And we found similar results in samples of very young children, like 6 months old. So there's probably something biological differences operating during the prenatal period that we need to understand further, and we're psychologists, so we don't know much about that, but we'll work with other people who will help us think about this.
Oh, perfect. And then while we're on the subject, and you both are in question answering mode, a question came through a bit about, Julia, you had mentioned that it was not an incredibly diverse group in your research. And it sounds like they're based on Nicholas's comments that there's additional research that's happening out there on this topic. So is there research about more diverse populations that are sampled, and are the findings the same? Or, you know, what's your maybe hypothesis of what a more diverse audience might show?
Yeah, I would say all of our samples are pretty similar in terms of diversity. They really reflect the general population of parents in Quebec, but still, I think, are not diverse when we think about the whole world and we want to generalize those results. But with the samples that we have access to, they're pretty similar to those of the general population. I would think we could hypothesize that we'd have different results in different cultures or different samples, especially for the role of reflective functioning. And reflective functioning might even be different in non-Western and Occidental cultures. And so that might be a whole different thing that we need to measure differently. But I think the research as of now and the development of the measures is based on kind of similar samples to us. And so we know very little about how to grasp that ability and how to measure it in other samples, if that answers the question.
Yes. Nicholas, anything you want to add? No, okay. So Veronica, there's a question came through for you about your research. How would you apply that going forward to any disaster preparedness situation? Like what would be the key takeaway that you could see being applied to any situation that may arise post-COVID?
I think really remembering to expand our definition of frontline workers was a big takeaway from this project. So not just the doctors and nurses who are seeing patients in the clinics or in the hospital, because these are people who are still going into homes, who are interacting with patients and families, or clients, I suppose, and families on a daily basis, and need the same recognition and supports, really, that all of the other frontline workers do. And I think expanding that also to remember that they're exposed to the same vicarious trauma, compassion fatigue, burnout that other healthcare workers are. And the trainings, the mindfulness, virtually, the flexible work schedule, those things are all helpful. But there is something to be said for other types of physical support and recognition as well. And I think just the overall flexibility in approaching problems and problem solving is really what we were struck by during our research, and how different CPS organizations were able to come up with different creative solutions to problems that hadn't existed, a few months prior. Was really fantastic and inspiring as well.
Oh, thank you. It's a wonderful answer. Tammy, anything you want to add to that?
No, I mean, Veronica summarized very nicely. We actually put some recommendations up on our website that we, from the learnings from our work, came up with a few recommendations for communities and others to think about, because sadly, there'll be other disasters where children are at risk. And also, like Veronica highlighted, our frontline staff are also at risk for additional trauma. So those recommendations are on the website that I put in the chat box.
Oh, thank you for sharing that in the chat. I was just going to ask you to do that. So thank you so much. And this is kind of along the same lines, and some of it, you've kind of answered along the way, both of you, but it just said, based on your research, what do you believe should be done differently and done the same? Like what were your key findings there in regards to what worked and what didn't, in this?
Well, in terms of how I would conduct this research, again, I think the big thing that our research was lacking really was discussion with the families themselves, which would have been fantastic had we been able to include the kind of, first person viewpoints of those people who are really affected by all of these changes, in addition, obviously, to the caseworkers and administrators. but it was a very valuable experience being able to have these one-on-one conversations with the people who were interacting with these families every single day. You know, I'm an emergency room physician, so I certainly had my own share of one-on-one interactions with patients during the pandemic, but having this different perspective and being able to share that with the team was really rewarding.
May I ask how you handled your own secondary trauma, vicarious trauma?
Exercise. I mean, I think that it was really challenging for all of us. For the beginning of the pandemic, it was still in residency, so it was you know, I was in a slightly different position at that point, but it was certainly it was a scary time, and it made me really understand when I was conducting those interviews the fear that the caseworkers had and the importance that we all placed on having appropriate PPE and, you know, having that the recognition. I was lucky enough to be in a large children's hospital where we had donations from organizations, and, you know, we had food delivered to us occasionally, you know, like we felt like we were being acknowledged for the work that we were doing at the time, which is huge. So I really understood where they were coming from in expressing their frustrations surrounding that lack of recognition.
Thank you. Thank you for sharing the personal side too. I appreciate it. Sydney, there was a question. You mentioned an upcoming publication, and I think people are curious about when they might see that.
We had some troubles because a lot of countries and regions, they had these deadlines to publish data on the second year of the pandemic. But some countries provided a prank on us, you know, delaying, not providing the full picture of the reports. So we had to reorganize everything and try to search for papers that provide some of that data for us. I think hopefully by the end of this semester, we're going to have the second year analysis ready. But this year already, we had some research that is published already that it aligns with what Veronica and Tammy worked on with case workers and child protection professionals from this group. We had published the survey with professionals from 57 countries. If I'm not mistaken, it's 57, but it's 50 plus countries, professionals' experiences during the pandemic. But this analysis of the child maltreatment reports and countries' response probably going to be submitted by the end of this semester. It is a lot of work to try to compare those things that are so different. So when you look at Canada, for instance, you have the different provinces, different organization of those systems. And when you compare to Brazil, that is a continental country that has a federal system, but it seems that every city does how it likes, you know, it doesn't seem to have a pattern, even if it is a federal system. So sometimes we get stuck in how we're going to compare those really different things and how we're going to compare one data that seems to be a decrease, but when you look at hospital admissions, it shows an increase, but it's a huge increase. So this is what takes us some time to actually try to get it right. I think that's the main point for us. You know, it's really hard to get it right with the data that we have available.
Well, you just answered the question that came through for you. Is just how do you compare such different patterns of your research of the data that came out, and then how do you form a key takeaway? Like how do you form a starting point for further research based on such disparity of results that you saw based on the geographic area?
And I think we learned a lot from our first paper because at that point, everybody was like, what the hell is happening in the world? You know, nobody knew exactly. The schools are closed. We're working from home. Everybody was baking bread, you know. It was like this crazy moment in everyone's lives. And we were trying to figure it out because a lot of countries, and Brazil is one of those, the country had a blackout of data. So the federal government just shut down all access to data, and we didn't know what the hell was going on. And we had countries that had a real-time data about child maltreatment. So I think the first paper was a learning curve for us. Okay, we have a lot of those different scenarios and how we're going to see what is happening. And as the pandemic progressed, and unfortunately the number of cases and deaths increased, we saw that a lot of countries were doing way better. And that seems to mimic what happened in the Child Protection Service as well. So it seems to us that how the country response to COVID got better with time. It got better, the child protection system and kids getting back to school and all of that. It was like a chain reaction of good things. But with countries that had a bad response, we have a saying in Brazil that happy families all look the same. Unhappy families are unhappy in their own way. So it seems that the countries that got a bad response, they all get their unique bad takeaways with child protection. So that seems to be our takeaway with all of this data. You know, when things are doing great, you know, just don't try to change anything. But things are going bad, you're going to have a good look on where is the problem is with the healthcare department, is with the educational settings, with the lack of access, how we're going to respond to that.
So that would be my next question, the practical application from your research. I mean, can you identify what you would, see as a practical application from what you know now?
I think the main application, I was in Mozambique last week and we faced a cyclone, and that changed the whole dynamic of the society. And in Brazil, we don't have earthquakes, cyclones, tsunamis, and whatever. So it was very scary for me and my team. And at the same time, we saw how those professionals answered to that call. So I think disasters are going to keep happening, and with climate change, that is going to just increase across the world. And at the same time, I think the COVID gave us how we can prepare better so we do not lack access for children to receive care from the service. I think that's the main application. So you can see how countries that had a good response and how they protect children and they were not affected in the child maltreatment reports, how they dealt with the pandemic and how they dealt with the disaster, and how countries that were just lost in translation dealt with that. So I think climate change is going to create a lot of those mini disasters across the globe. And I think those papers can help out countries to better prepare themselves to deal with those kind of disasters.
Thank you. And that resonates so much, Veronica, with what you were saying as well. Like if we don't use this as a learning curve, if we don't do post-pandemic analysis of what worked and what didn't in a practical application, I think we all feel we're one natural disaster away from needing to implement a lot of what your research looked at. And I was going to ask you as well about practical application. I know that Tammy had mentioned as well, what's on your website. But if you were going to say, Veronica and Tammy, what would be your practical application from your work or your next step research? What would that be?
I think it would be really interesting to kind of reflect back on how things have changed since the pandemic ended, so to speak, or kind of how some of the new processes and procedures that were implemented during the pandemic by Child Protective Services have continued to help, streamline their existing workflow, or how things have changed back to how it was before, how they see the changes that were made impacting their future, and really get that from the primary source again, as opposed to, our speculation. So I think that would be very interesting. And as I alluded to as well, if it were also feasible to include the points of view of the families who did have that support during the pandemic, how that was helpful or not helpful, or what other additional supports could have been more helpful or additionally helpful at that time.
Yeah, and so it would be fantastic for us to be able to talk with families to learn a little bit more. We, at the American Academy of Pediatrics, I mean, some of this work also was to try to inform and educate pediatricians about opportunities to provide information to everybody, you know, to all of their families related to intimate partner violence and it, you know, should they have any concerns, make that connection to IPV advocates and others who can support them. And as someone stated in the chat box, you know, we know a lot about when caregivers are indeed sort of in that survival mode, how difficult it is for them to provide those safe, stable, nurturing relationships, right? So again, working with pediatricians to help caregivers feel safe, and connected set when they are ready to share information, that pediatricians can connect them to the resources that they need. So, you know, we continue to take lessons from the information that we gathered from that study and really try to apply it to educating pediatricians and other pediatric healthcare clinicians about trauma-informed care. And again, providing the support and resources to families so that they can thrive even in difficult situations like a pandemic.
Thank you so much to both of you. And thank you for sharing your website. I'm assuming that all of these great tools and resources are open access. And again, we thank you for that and would love to help at ISPCAN disseminate that great work on our site as well. So again, I think what you've come up with is really important in our whole, you know, process of taking data to action, you know, and to make change. So, and Julia and Nicholas, I kind of have the same question that came through for you as well. Like, where do you see the practical application of what your research showed? Because I do think that there's a lot there that could really impact child development. So, we'd love to know, you know, what your thoughts are.
Yes, happy to. I think, yes, these results can impact both individual interventions as well as group intervention. And since we have an expert on this, Nicola, that's here today, I wonder if you want to introduce people to the STEP program, which is the intervention that this program led to.
Yeah, of course. Thanks, Julia. Yeah, I think that Julia showed in her paper how important is reflective functioning for resilience in parents who experience childhood trauma, and how important this is for their children as well. And fortunately, there are a lot of very interesting programs targeting mentalization in parents who experience childhood trauma. We can think of Nicole Letorno's work on the attached intervention, all of Alicia Zimmerman work on parental psychotherapy with survivors, Maria Music and Kate Rosenblum mom power intervention, Howard Steele work. So there are a lot of very interesting interventions. What Julia shows well is that we can already see these problems arising during pregnancy, and there's probably an opportunity to intervene even before childbirth. So that's what we tried to do with a program we developed. It's called the STEP program, STEP standing for supporting the transition to an engagement in parenthood. And which is unique with this intervention is that we try to intervene during pregnancy and trying to support mothers with understanding the impact of trauma on their current functioning and their experience of parenthood and motherhood. So it's 8 to 9 sessions, group intervention designed for mothers who experience difficult life experiences, which aim to sustain maternal well-being during pregnancy in the years following delivery, support maternal bonding and healthy development in offspring, and we hope, contribute to interrupt the intergenerational cycles of childhood maltreatment. So it's an intervention that we developed mainly based on Julia's findings and other evidence we have that mentalizing is crucial to support resilience, and maybe even more so mentalizing around the issue of trauma, since we have other results showing that even more so than parental reflective functioning, trauma-specific mentalization seems to be very important as it comes to parenthood.
Thank you to both of you. I would love if you have the opportunity to put in the chat maybe links to the STEP program and some of the other great resources that you mentioned, Nicholas. That would be great. And also for all of our authors, any additional resources that supported your work or you would like the audience to have access to, email me and I will make sure I put it on the host page with the recording from the session. Because I think all of you shared some really incredibly impactful resources and programs out there to support the great research that you've done. So thank you. I would really appreciate that. And I'm sure the audience would as well. And I believe that we've answered most of the questions that came through the chat or sent to me directly. And I believe we have. And thank you to our authors who answered some of them in the chat box. I really do appreciate that as well. So at this point, I would, encourage the audience. We have our last call for questions. If not, I would really like our authors, if they have any key takeaways. I know we've hit a lot of things like practical application, resources that have come out of your research, but if there really is any key takeaway that you would like to share with the audience, please feel free to do that now. I do want to offer special thanks to Sydney, who really did step in at the last minute to present this work for Ilan, who was unable to join us. So thank you so much that you flawlessly presented that presentation. So thank you. Again, for our authors, any key takeaways? Nicole, anything you want to share before I do our closing session?
I think as we're talking about the COVID-19 pandemic, I think it's also worth noting that all of these authors did this work in that context, which was not an easy time to be doing research given what was going on. So I think this is especially great achievement, and also especially thank you for your work. And I'll let the authors give their key takeaways, but certainly I know what they have shared already has been simply excellent. So thank you for your contributions.
Veronica, Julia, Sydney, any key takeaways? If not, I know you've covered a ton and you've done an amazing job presenting your work, so I'm not pressuring you, but if there's anything you want to add, feel free.
I mean, I can do a closing takeaway. I think from our results, they really suggest that as early as pregnancy, so before the child is even born, we're able to identify certain caregiving risk and protective factors for child development. And I think that should really inform future research and intervention, as the importance of that critical period that is pregnancy and early infancy for future development of healthy and safe children's.
Thank you. Perfect.
I think one of them. Oh, sorry, Veronica. Sorry, you can.
I was just going to say, just to reiterate the importance of taking care of our caretakers and thinking about strategies for how we can expand our definition of those caretakers as well, but thinking about new and innovative ways to support. And then really focusing on, yes, there were many challenges, but there were also many silver linings of the way that Child Protective Services and other agencies were able to adapt to the challenges of a pandemic, which was inspiring.
Perfect. Thank you. Sydney?
I think for us in the Global South is that the idea that we also have our own data, and sometimes when we try to copy and paste what is happening in Canada or the US or any European country, that code doesn't fit to us, I think that's the main point when we're trying to do this kind of broader research. When you think about what is happening in Canada, that was a complete different reality. And one of the things that really highlighted that for us is on the paper that just got out this year about how those professionals in developing countries faced the pandemic. So I think for us, it's really important to have our data out there so we can say, oh, I know this works for Canadian people, for Americans, for Europeans, but that does not work for us here in our context, because we have other vulnerabilities that were surpassed, or they are not really a problem anymore in those developed countries. So I think that's the main takeaway that we take from this group. You know, we have colleagues from Colombia, we have colleagues from Uganda, and we face different realities. So we gotta hear what everyone has to say to have like a common goal towards child protection.
Wonderful. Thank you so much.
I'll say too, Sydney, that we have a forthcoming special issue on the prevalence of ACEs in low and middle income countries in the journal. That actually the release will be, I think, in the next month or so, led by Shanta Dubé and colleagues. And so I think there's also a really important recognition on the part of the journal that these experiences are different internationally, and but also very important. And that attention needs to be paid to that. So people can also look forward to seeing that in forthcoming in the next month or so.
Thank you so much, Nicole. Well, we would like to extend our heartfelt thank you to all of our authors, to the great work that you did, first of all, to Nicole's point, to do the research that you did and the quality of research that you did during the time that you did it is really outstanding. And I'm so glad that you were recognized through your awards for your papers. So, and it was really an honor to be able to showcase that today. So thank you. And also thank you to Nicole. It's always so wonderful to have you here and to represent the journal. So it's so appreciative to have you here as a moderator. And for our audience, you know, we really are always trying to make our sessions better and more impactful and a better use of your time and meet your needs. So there is a feedback survey that'll happen after you disconnect from Zoom. If you could take just 3 minutes to do that survey, we read them after every session. We make changes, we adapt, and we listen. So we would really appreciate that. I do want to just remind you what's coming today after the session. So all the presentation slides, any resources that were shared by the authors, the full recording from today's session, and an ISPCAN certificate of attendance. And then Nicole alluded to this, and feel free as well, Nicole, to chime in, but we're so excited about our new journal as well. It's an open access journal. It really brings practice to light. There have been multiple articles that have come out in the last month, like kind of our showcase articles for this first kickoff, and it's very exciting to see what's out there. So we're really trying to bring data to action. This is a practice-based journal, slightly different than our research-based journal, but a wonderful complement to each other. We also did a webinar on how to publish in a practice-based journal because we know it's different. That is on our website, so feel free to watch that recording. We had Chris Weckerly and Kathy join us to give tips as editors on how you can publish reports, programs, different any practice-based implementations that you have in your region. So it's just going to be a very impactful journal, and we've kicked it off now, and we waived the submission fees through December 2024 as an author, and that really is hopefully very enticing for many of you to present the great work that you have, and that goes to our audience as well. And Nicole, anything you want to add in that, or?
No, I think that's great. Thanks, Jane.
And Chris and Kathy's information is here. It's also on the website page. They are open to, as editors, answering any question you may have. They've made themselves very accessible to you during this process. And then we just invite everyone to join us in Uppsala, Sweden. Registration's open now for our Congress, our International Congress that is happening in August. Early bird rates end in June. And I think if you get on our website and really look at the great work that is going to be featured, we had record-breaking abstract submission, and the quality of the abstracts were beyond anything that we have ever seen. It was a very competitive process, and we're very excited about this Congress. So visit our website for all the information on that. And just things up, new and different for you at ISPCAN. So please consider visiting our website. If you're not a member, please consider joining us for member benefits. For as low as $35, you can have access to all of the great things that ISPCAN has to offer. So we encourage you to visit the website to see that as well. And most importantly, I just wanted to again say thank you so much to all of you for your time today. And, you know, we know how busy all of you are and in your research and in your practice. And so again, just a heartfelt thank you. And I hope that you were able to look in the chat as well and see the overwhelming response from our participants today. So, and just a true appreciation for what you're doing. So thank you to you all. Good morning, good evening, good night, wherever you are in the world. And look for the follow-up email with all of the information sent directly to you. So thank you, everyone.